Good morning, everyone. We're at a healthcare event, so everyone please stand up. There we go. Stretch a little bit, everyone. If you're not standing, you're doing the wrong thing. I don't care how old or how young you are. Stand up. I'm giving you 1 of my minutes for your own health. Come on, stretch. There we go. Nice, big stretch. Okay. While you're standing, how many people have felt disenfranchised or surprised by healthcare or a healthcare bill they've received in the past? Excellent. So we'll have a great conversation. My name is Adi, and I'm the CEO and co-founder of SeeThru. At SeeThru, we're trying to fix the problem of transparency in healthcare. As you probably know today, healthcare is unaffordable and opaque, and that's kind of like a catch-22. It's opaque, and therefore it's unaffordable. It's affordable, and therefore it's opaque. Anyway, you have all experienced this in some way. So we've had conversations with people who are just coming into the workforce, as well as our potential billion-dollar investors. Not that we're raising $1 billion, but people who are worth that much. And everyone, no matter how much money you have or what kind of healthcare experience you've been through, you've had some time where you've received a bill that you didn't expect. So we'll go through some of the numbers and kind of talk about what the problem is. But I think the first thing is to realize that healthcare is the only industry where you provide a form of payment before you know what you're getting or how much it's going to cost. That would be outrageous in any other industry. If you walk into a restaurant, for example, you would never order a steak or an omelet and you didn't know the price. And we do this in value shopping, which is on Yelp today, where you'll look at a review site and then you'll look at the prices, or whether it's on Amazon, and we'll get into that example later, where again you're looking at quality and price, or even in a clothing store. You would never go and buy a blazer, submit a payment, and they would say, okay, thank you, Mr. Schwartz, we'll see what's covered and we'll send you a bill for the rest. All of a sudden you could have just purchased a $5,000 blazer, and it would be out of your control at that point. But for some reason we give into that in healthcare. So we have a problem today because we are moving towards the direction of high deductible health payments. And so that means that there is 50% of the country that we should realize that is on government insurance, so whether that's CMS, so Medicare and Medicaid, or another government plan because you're a government worker, or the Department of Defense, the VA, there are a lot of plans like that. But there's the rest of the 50% of the country. 43% of those folks are on a high deductible plan today. So that means that you're spending anywhere from $1,500 to $15,000 out of pocket before you're even being covered by your insurance. That's the patient side. The problem on the provider side is that providers are not getting paid what they want or when they want it. So right now, providers expect to only get reimbursed 30 to 40% of what they are paying, of what they're charging, and it takes about 120 days to get paid. So that's a really long sales cycle, if you will, for the providers. If someone walks out of the doctor's office and hasn't paid, it takes about, and this is obviously an average, so you can't send 3.3 bills, but on average 3.3 statements before someone ever pays. So the problem is actually collections. There's the price, and then there's the collections. And we'll get into what SeeThru does, but essentially we have a platform that allows you to shop for value, and you can actually choose by price, by quality, and you pay ahead of time. So for the provider, you're getting paid ahead of time. For the patient, you're actually knowing the price before you ever walk in. And we'll look at the platform. When you talk about industry size, Eric showed on his slide a bunch of why certain companies were attractive, especially in the pathology space. And those were some nice numbers, but I'll show you this number, and this is $500 billion. So that's the amount of money that we are spending every year in the US, and this is the US alone, out of pocket for healthcare. It's a huge number. And then you look at another, I guess I didn't have that slide in this one. The other side of the industry is $450 billion. And again, this is coming out of a $3.7 trillion expenditure, which is approximately 20% of our GDP today. So already this is a huge amount of money. But $450 billion is the amount of money that we are spending on revenue cycle management and bad debt today. So I got the three-minute mark. I'm going to jump right into what we're doing. We have a platform that eventually will be built on blockchain. That is a buzzword today, we agree, but we are pretty bullish on the technology, but the infrastructure is not there yet. So just to be clear, We're not just a scam. We do believe in the technology, and we will build on it as the tech infrastructure allows for it. Right now, we are a traditional platform that allows you to sign on. You see exactly what you're getting ahead of time. So you see the doctor, where it's located, what you're going for, their rating, and that's a peer rating that we get within the platform, and all of you as participants in the platform will get that, and the exact price. If you come to me afterwards, I can actually show you some more of the platform and how that works and how the pricing works, and you basically add up a cart. This is completely changing the paradigm in terms of how we think of paying for healthcare and how providers are getting paid. Providers today are the only professionals, from your plumber to your lawyer, who don't get paid in time plus materials. We're going to change that. And the way we're doing that is having providers think about what their time is worth. For years, for generations, you've been told it's worth a code, a CPT code or ICD-10 code. Really, your time is worth money. So it doesn't matter whether you're seeing a sore throat or you're seeing a bellyache. What really you're doing is giving someone 15 minutes of your time. And that's what you should be charging for. And so, for example, if you look at a charge master, which if you talk to anyone in a health system is considered proprietary, so you cannot really get that unless you have the inside scoop. For example, we looked at a hospital that we're working with in the Bronx. Their most expensive thing they do is an $84,000 cochlear implant. And that doesn't include the actual cochlear implant, that's just the procedure. And that also doesn't include anesthesiology. If you break that down instead by what that neurosurgeon or that ENT actually wants to make, let's say they want to make $1 million a year. Okay, and then you divide that by how often they want to work, and you also add in their overhead. At that point, once you've done that calculation, you can come up with their hourly rate, which is about $625 an hour. You multiply that by the amount of time an average cochlear implant surgery takes, which is about 3.5 hours, so we'll give them 4 hours. You add in another hour for the anesthesiologist time, and then you include some time for the overhead. Right now, you've actually, and then, by the way, you'll add on another hour or two for the office visit you have before and after surgery. And then add on $500 for a cochlear implant. With all of that money, that procedure actually becomes between, depending on where it happens, $5,000 and $10,000. And that's paying for everything. So if it's an out-of-pocket expense, first of all, it's much more affordable, even if you do go on a payment plan. And for the provider, they're actually getting paid for that procedure. And it turns out they only have to do 178 of those procedures in a year, which is about half as much as they would do if they were doing normal procedures based on where the collections happen. So I just threw a bunch of numbers at you. I think it's better if we do some questions. Bottom line is we have recruited an international team, including folks who are full-stack developers. And one of our chief strategists was a hedge fund manager for 20 years, including owning his own. I personally am a med school dropout, and have been working in health tech for the last 5 years. And we've recruited also ambassadors throughout the world who are very driven by our mission. We have a stellar team of advisors from throughout the industry, both health tech, from the finance world, as well as healthcare and the regulatory world. And we are currently closing our round on $500,000 at a valuation of $4.5 million. Soon after, we'll open up another round for $1 million, and I welcome all questions. Thank you very much.